So, before we go to something like ketamine therapy, we can do something like cold water therapy, add the medical cannabis, and a lot of times that gets them to where they need to be. There is quite robust evidence that, first of all, legalizing cannabis for adult use does not increase the amount of teens and young people using cannabis. If you smoked huge amounts of high THC, black market cannabis and joints every single day for years and years and years, there's probably around a 8 to 9% chance of having a cannabis use disorder. That being said, alcohol is about 20% if you did the same thing. So it's lower risk than a lot of other substances. Just to give people a reference, if you smoked a whole joint, you might get 100 to 150 milligrams of THC in about 5 minutes. I'm talking about 1 to 2 milligrams of THC over a long acting period of a few hours. So it's very, very different than
microdosing.
It's
so you're not going to get the munchies on that.
No, you're not going to get the munchies. So ketamine psychotherapy is a treatment we can do now in the UK for treatment-resistant chronic pain and for treatment-resistant depression. So there's a biological component. So even if you did, the famous and experienced ketamine doctor, he's a professor at Oxford, and he actually, in his clinic, they don't use any therapy. They just use the biological method of treating patients with depression with ketamine, and it's actually quite effective. But it's more effective when you add the psychotherapy component, because what happens when you're in the session and you have this altered state experience where you have a dissociation at these higher doses, is then you can have some insights sometimes, and those integrating those insights and kind of unpacking the boxes in the brain, so to speak, and looking in them and kind of integrating those boxes is very beneficial. So ideally, it's both together.
So it's sort of helping you create that observer effect. Is that what you're saying?
That's right. That's right.
Interesting.
Yeah.
Which is actually quite I remember when I was going through my own journey with psychotherapy, actually developing that sense of being the observer really took practice. It takes time.
Yeah, exactly.
So this sort of accelerates it.
It accelerates it, and there's a biological antidepressant effect and anti-pain effect right away as well. Yeah.
But how long, just while you're having that infusion, or does it last after the event?
It lasts, but every person's different. So for chronic pain, for example, you might have to top people up every 2 or 3 weeks, or maybe every 2 or 3 months. The same with depression. Some people can get months and months after they've had a few sessions and they're stable. They can get longer and longer periods of time of remission of their depression symptoms, but sometimes they need to top up. So it's not a permanent cure, but as you said, it's more quick antidepressant effect. It lasts for a while, and then alongside of the observer effect and learning to live alongside the depression rather than having it consume your whole person.
It's really interesting, because as soon as you teach stuff like that, right, you can't unlearn things. That's why I think it's so useful, because now you have that in your toolbox. Are there any side effects to it?
When you choose the patients well, they're actually very well tolerated. But of course, you have to make patients comfortable. They have to be comfortable with that altered state experience. So it's done obviously in a medical setting, which is very safe and very reassuring for the patient. So when it's done that way, there's very little side effects. But obviously with any medication, you have to choose the patients carefully, and of course under only experts.
Yeah, make sure you find the right person like yourself.
Exactly.
What about do you use any kind of psychedelics at all?
So ketamine is considered a form of psychedelic assisted psychotherapy. It's the only one that we can legally use now in the UK. But of course, there are many others. So many of my patients have gone through psychedelic assisted psychotherapy in various forms outside of the UK, where it is legal, and it can be incredibly transformative for people. So, and that's one of my areas of research interest is psilocybin, which is a magic mushroom extract, and also things like ayahuasca, which is one of the main ingredients is DMT from a vine in the Amazon, and there's also some others as well. So there's a lot of ongoing studies here in the UK using psilocybin and DMT derived plants for things like PTSD, eating disorders, anxiety, depression, with some promising initial results. But of course,
DMT is what you can produce naturally through breath work if you're doing it correctly.
Yeah, there's no big studies on that, but there's some potential there, we think, for producing natural DMT, and it is something that we produce naturally as well. You're exactly right. So it's using these substances in a safe way, in a really responsible way is also really important, because I've also, I'm involved in the healing community for many years. So of course I've also seen it go wrong, where people they go on a psychedelic journey and it just has gone wrong for multiple reasons. And sometimes it can make people more traumatized. So it has to be done in such a safely held container. And of course, here in the UK, it has to be just ketamine. We can't use those other substances yet, but some of my patients have gone to the Netherlands to do personal growth retreats with psilocybin, or gone to the Caribbean where they can do those retreats now, or Costa Rica where you can do ayahuasca retreats, or the Amazon. So I do have a lot of experience working with people and helping them with the integration of those experiences, and they can be really life-changing. But of course, you got to do the integration work. Otherwise, it's just a peak experience and it's just fleeting. And holding the set and the setting in a really safe container is just really important.